So today we're welcoming Sumi Subramaniam, who, as Peter's already mentioned, is now a Principal Development Manager for Health in the Ministry of Foreign Affairs and Trade. But Sumi has a really long and distinguished track. She started out as an economist. She did her Masters in Health Policy at Johns Hopkins. She actually has spent a lot of her working career in the United States, but also globe-trotted quite a bit, and so we will hear about that, I'm sure. And her central interest is in health policy, and we're going to hear a high-level picture, and it's particularly relevant. We're very grateful, Sumi, that you're bringing this to us, because Sumi's interests are right centred on two areas that are a part of our centenary projects, around vaccination and also around sanitation and clean water, public health issues in the generality. So as you listen, this is also something of a briefing on background to those two very significant areas that we're embarking on as projects. So Sumi, welcome, thank you very much for coming along, and pass over to you. I think Patrick, the clicker is needed.
Kia ora tātou. I have the honour of being here today post-lunch, so I do understand if it's not usually a preferred spot right after lunch because people tend to get a bit drowsy-eyed, but thank you once again, Rotary New Zealand, for the invitation to be here and share a little bit about what I'm passionate about health and development in the Pacific. In my role currently, I have the privilege of providing the lead advice on health policy and strategy to the Pacific and Development Group of the Ministry of Foreign Affairs and Trade. And I work with partner country governments and development partners on very similar issues. Now I just have to figure out how this works. There, right. I want to start by addressing why we care about health in the Pacific in the first place. Development in the Pacific is very important to us. We have international commitments through Sustainable Development Goals that New Zealand has signed on to. We have signed on to World Health Assembly resolutions. We have regional commitments through things like the Pacific Islands Forum. There are ministers of ours, both in health and other sectors, who have signed on to committing to progress in the Pacific. And there are bilateral commitments that we have with our partner governments in the region. Health is also unquestionably a key driver for growth and development. It's important for the survival of our children, helping them to learn better and contribute to an able-bodied and productive workforce. But not just that, we have a domestic interest, which doesn't always come to the fore, but I think it's really important for us to remember that, is that the emergence and spread of new microbes go past boundaries. They don't respect borders, and these are health security issues that we have to be conscious about as well. So investing in strong health systems in the Pacific is important not just for the countries themselves, but also for us as New Zealanders. And not to lose sight of the fact that we have relationships with New Zealand brown countries and diaspora in New Zealand who are a big part of our society. And there are expectations there, there are relationships there, and we have responsibilities there as well. And we're increasing numbers of people travelling between the region and across countries, seeking care in New Zealand, often leading to rising costs in New Zealand's domestic health sector. So all of these sort of come to mind when we talk about why should we care and why do we care about health in the Pacific. I'll start briefly with what is the current situation. There are some good news stories there. In the last 25 years in the region, some of you may be familiar with this, as Rotary has contributed to several of these. Across a range of key indicators, the Pacific has showed really good outcomes compared to other similar low and middle income countries. Life expectancy in the Pacific has increased from 65 to 70 years. So if you take that and compare that with other low and middle income countries, it's only gone up from 65 to 67 years. So that's really commendable. There are fewer deaths among children under the age of 1 and children under the age of 5. the infant mortality rate in the Pacific has dropped from 36 to 23 per 1,000 live births. That's quite an achievement. Similarly, the under 5 mortality has dropped from 45 to 28. What else? There are a few number of women who die from pregnancy or childbirth-related causes. That's a very good thing. The maternal mortality ratio in the Pacific fell by more than half, from 186 to 84 per 100,000 live births. And then polio and neonatal tetanus. Polio, of course, is an area that Rotary's been engaged with for a long time. The Pacific has successfully eliminated polio since 2000 and continues to be polio-free today. The same is the case with neonatal tetanus. That's been eliminated. Tuberculosis. The prevalence of tuberculosis is reduced by 1/3, and deaths due to tuberculosis have reduced by 2/3. All very, very significant achievements. And there are many more. Lymphatic filariasis has reduced, the number of doctors in the region has gone up. The Pacific governments now have full ownership of their national immunization programs. Pacific leaders have made very strong commitments both to the SDGs and to things like tobacco-free Pacific by 2020. And these are very, very commendable, but unfortunately it's not the full story. What has happened is that the gains in life expectancy that the region has seen, they're not being even across countries. And some countries will never, will really, really struggle to achieve the Sustainable Development Goals. The gains in life expectancies that have been made are really at risk today because of the rising burden of cardiovascular disease and diabetes and cancers and hypertension. Collectively refer to them as non-communicable diseases. NCDs today account for nearly 70 to 75% of deaths in the Pacific. And the complications due to NCDs cause even more of a burden with amputations, loss of sight, and kidney failure. And the risk factors for non-communicable diseases are continuing to grow, whether it's tobacco consumption, poor diets, lack of physical activity, excessive consumption of alcohol, all of them. But that's not just it. We have 1,700 children under the age of 5 who still die every year. More than 80% of these deaths occur in the first year, and half of these occur in the first month after the baby is born. There is a tremendous burden of malnutrition in the Pacific. Now, that's not the first thing that comes to mind sometimes when we're also talking about childhood obesity in some instances. But it's been quite startling to discover that the rates of stunting in children under 5 has gone up in the Pacific over the last 15 years, over the period of the Millennium Development Goals, while other regions like Africa and Asia have shown a reduction in childhood stunting. In the Pacific, it has actually increased. Data from last year has also told us that vaccination coverage is very uneven across countries, and it's even more so for the new vaccines that are going to be introduced in the region. For example, in Vanuatu, only over half of the kids were given the first dose of the measles vaccine. Only 65% got the third dose of polio. In Kiribati, only 66% were given the birth dose of hepatitis B. And for new vaccines like PCV for meningitis, rotavirus, or HPV, the situations are even more challenging. With only 4 countries, with 4 countries that haven't introduced any one of the 3 vaccines. Some of the others have introduced one of them or 2 of them or have a plan for them, but it's still slow progress. The other thing to note as well is that over 50% of the Pacific is under the age of 25. Now, this is an age group often characterized by high sexual activity. So you have teenage fertility rates, teenage pregnancy rates rising in 8 out of the 14 countries of the region. It has implications for not just pregnancies and childbirths, but also for sexually transmitted infections in the region. And last but not least, the frequency and the range and the causes of mosquito-borne diseases has been increasing since 2012 for a variety of reasons. Over the last 5 years, there have been 58 recorded outbreaks of dengue, 3 different serotypes of dengue, Zika, and chikungunya in the region. So that's what the current situation is like. And all of the issues I've talked about are there challenges that the health systems in the region are facing. What is important to remember, though, is that these stats are a function of factors which are outside the health system at times. And the responses to these are often left to the health systems and countries, and its very limited resources to address and prevent and treat. So for example, when you have poor sanitation and poor sewage systems that contribute to infections, when you have ready and cheap access to poor nutritive foods, 2-minute noodles and highly concentrated, supersized sugary drinks, cheap tobacco and alcohol that reduce the options for healthy lifestyles. And you have climate change and events that are related to this that cause an increase in vector-borne diseases and respiratory illness. All of these place an immense burden on the health systems of the countries, and which are extremely fragile to start with. But the other thing to, I guess, recognize is that healthcare is almost entirely publicly funded in the Pacific. And the total health expenditure ranges from about 4 to 7% of GDP for countries, and it places an enormous responsibility on the country governments to provide for their people. So for example, a country like Kiribati, under 100,000 people, spends about $200 New Zealand on health per capita. In Solomon, it's about $123 per capita. And compare that with New Zealand, that's about $6,500 per capita that we spend on health for our people. And what we're also seeing is that increasing proportions of these limited finances that countries have go towards hospitals and go towards salaries. In the instance of Vanuatu, for example, hospitals account for 50% of the government's health expenditure. And the annual budget for medicines and supplies has not gone up in 10 years. It's been maintained for $1 million for the past 10 years. So what happens is, in the middle of the year, the budget runs out, and there's no resource for medicines and supplies. The other thing is the context of the Pacific itself. Service delivery is expensive, particularly in outer islands with very small and scattered populations. It's a complex and changing burden of disease. It's hard enough to prevent and detect and treat normal diseases, if I may use the term. But with chronic disease management, it becomes even more challenging, because you have to have regular interface with patients for diseases like diabetes and hypertension. And outer islands often have a small aid post staffed by a midwife, maybe a village health worker, and so the service delivery aspect of it becomes really hard. Referrals are expensive and difficult. Transport to get patients from one place to another is also very difficult. And I guess the last thing that I wanted to talk about with respect to the challenges is the high reliance that countries have on external support and donor funding. Currently in the Pacific, there's Australia, New Zealand, Japan, France, the USA, and China, who provide donor funding for health. But this support is also often earmarked for specific diseases, for specific areas. And so what that does is, and the amount and the timing of funds is often determined by what domestic country governments want to prioritize, and depends on the political climate of the donor countries themselves. So recipient countries often do not have a say about how those budgets can be used. They don't have a say on, they don't know how long that funding will be available for, and can't plan on an ongoing basis about how they allocate their funds. So which adds to the level of challenge that we're talking about here. But it would not be fair to leave this room without recognizing the opportunities that also exist. And I want to get into that a little bit. In recent years, the Pacific has liberalized telecommunications and invested really heavily in fiber optic cable connections. Mobile and internet technology is likely to increase significantly over the next few years. And we will and should have an unprecedented opportunity to use technology to consider some alternative models of service delivery, like telemedicine, and perhaps solutions for the very unique challenges that the small islands have. The other change that happens to be occurring is, and potentially could be an opportunity for the Pacific, is that there's much greater global recognition of the unique vulnerabilities of small island developing states. Perhaps partly to the role that like partners like New Zealand in Australia and others have played, and organizations such as yourselves have played in the space. And in a world that was mainly focused on the challenges of Africa or South Asia, the needs of the Pacific are getting recognized in terms of how unique and vulnerable that they are. And as a result, more resources are likely to flow into the region as a result of mechanisms like climate change financing and other donors. The Pacific countries, for example, will have access to the enormous resource envelope from the Green Climate Fund, which has about $10 billion already committed, and pledges of another $10 billion. Now, of course, because the Pacific is uniquely vulnerable to climate change, one would imagine that they stand to gain from some level of support from these resources. In addition to that, you have organizations like the World Bank who have, for the first time, talking about investing in the Pacific by $200 million coming into the Pacific. And that automatically also provides sort of insurance coverage for the Pacific for any kind of pandemics that arise in the region. So they're covered by something called the Pandemic Emergency Financing Facilities to prevent an Ebola-type outbreak, for example, in the region. The Asian Development Bank, once again, is coming to the Pacific to focus on health issues. So these are big partners, big money, big resources for the region, which is all great news. And finally, I think one other thing that's becoming clearer is the recognition that other sectors and other parts of the government have in terms of the role that they can play in addressing health outcomes. And this includes everything from public finance to taxation to the law enforcement that's required, to management of trade tariffs, to ICT. So it's that recognition that the actions that all the other sectors take have an impact on health, and therefore they have a role to play as well in addressing health. So these are all sort of new and evolving areas in health in the Pacific. I guess I just want to finish up by saying that what we need to do is New Zealand is trying to work in this context in light of the challenges and the opportunities that I've just talked about, and seeing what is the best way that we can support the health of our immediate region, and to balance that against our international and regional and bilateral commitments. The next few months will of course be very crucial as our new government determines policy directions and resourcing for how we engage in the space. And so we'll be looking forward to working with all of you and with other government partners to support any new direction that comes about. Thank you very much. I'm happy to take questions.
We've got time for some questions, so who would like to be first? John.
I didn't quite follow when you said that the health was publicly funded, but then it was dependent on donors. Are you meaning that the donors assist government, which then assists medicine, or are the donors directly into the hospital?
They do both. They do both. The donors sometimes give money to governments, and New Zealand does that as well. We give money to partner countries, and they determine how much goes to health, how much goes to education, and they do their own division. But in addition to that, donors sort of have a polio eradication program, or they will come in with introducing a new vaccine, or they will work in one particular community. So that's quite sporadic and different time frames, different amounts, different disease areas. So there's both parts that happen.
Next. No immediate questions? Denise.
Yeah, so you mentioned that there are challenges in the rollout of vaccination programs, and are there things that can be done to enhance that, or what can be done to enhance that?
Good question. The thing is with vaccination programs, as I'm sure you're aware with the work that Rotary does, it's the roadblocks and challenges exist at various levels. For example, when you're looking to introduce a new vaccine, the challenge often is sometimes it's resource, because new vaccines are expensive and the Pacific is really small, and to get the economies of scale that are required to bring prices down, that's a very different kind of challenge that needs to be addressed. The second part is once you have incorporated a new vaccine into the schedule, then the government has to work with its staff and the health workforce on ground about the frequency and making sure the stocks are in place, and inventory management, and making sure there's a cold chain in place. There's that level of support that's required. And then the training of the staff themselves about when when a new vaccine is introduced, about how they should administer it. There's that bit. And then, of course, there's the logistics part about how do you transport from the central warehouse or the regional center to the various countries. So there's many, many steps in that process in terms of challenges. But fundamentally, it does come down to the resourcing that a country has. And frankly, the 4 countries who haven't looked at introducing any of those new vaccines, well, I can't be certain, but some of the reasons for them are too expensive. They only have X number of dollars, and they have to cover polio, measles, all of the other essential childhood vaccinations, and to incorporate one more into their regular year after year after year immunization budget is going to be quite stressful, and they would have to plan for it in the really long term. So there's many levels of challenges that we have to support the systems through.
Denise, could you... Sorry, time's up. Denise, could you thank our speaker? Thank you, Sumi.
Well, Sumi, thank you for giving an excellent overview of what is clearly a really challenging area. And I imagine that many of us knew about elements of that picture, but probably may not have realised quite how widespread, wide-ranging and how complex these issues are. But Sumi, you also gave us a very clear pointer towards there are things that can be done, that external funders do have a role in making a difference, and I'm sure there's some useful insights in particular for the club, for the projects that we're involved in. And thank you again very much. If club members would please join.